Hi, good afternoon. My name is Albert, and I'm a nursing student in the BSN program at Nevada State College. How are you today?
I'm good. How are
Great,
you?
wonderful. I'll be doing your exam. If you have any questions, I want you to make sure you ask. And I'll be reporting my findings to the camera. Only
Okay.
my instructor will see this video, and then we'll erase it.
Okay.
Okay, any questions before we begin?
No.
All right, wonderful. So what we'll do is I'll do some hand hygiene here. And then what we'll do is we'll treat this as an exam room. We'll draw curtains. So basically now your privacy and your safety are protected. I'd like you to start by telling me your name and birthday, please.
Natalie Bose, 9/15/1982.
Okay, terrific. Now, do you have any chronic diseases? High blood pressure, diabetes?
No.
Okay. Have you had any surgeries?
2 surgeries. A vein removed in 2005 and my wisdom teeth in 2001.
Okay. Any serious injuries? Have you ever hurt yourself seriously?
2 times I needed stitches, once on my right leg and once above my right eye.
Okay. Do you currently take any medications?
No.
Okay. And are you allergic to any medications?
No.
Okay. Do you drink alcohol?
No.
Do you smoke cigarettes or other tobacco products?
No.
Any illegal or street drugs?
No.
Okay, excellent. How much exercise do you get within a week, would you say, a normal week?
I would say 1 hour.
Okay. Now, how physically active would you consider yourself, if at all?
I'm pretty active. I am moving around constantly.
Okay. All right, excellent. All right, well, you do appear to be your stated age. You appear to be alert, oriented, responding to me appropriately. Skin appears to be consistent tone with no unusual pigmentation noted. Your eyes, ears, nose, they all appear symmetrical, which is a good thing. Can you, and your mouth as well, can you please tell me, just walk me through what you eat in a typical day?
Breakfast, lunch, and dinner, and then 2 snacks in between each of those meals.
And what do you have for snacks?
Either a yogurt or an apple or something, chips,
What do you eat for breakfast?
cereal.
Lunch?
Normally a sandwich or a salad.
And dinner?
I try to make a protein, a carbohydrate, and a vegetable.
Okay, excellent, good to know. All right, your position looks relaxed, your posture looks a little slightly hunched over. Do you hunch over a lot?
Yeah, it's relaxed for me.
Okay, okay. Well, I see your facial expression is calm and your mood and your affect are appropriate for the situation we're in. And your speech is articulate and coherent, so I can understand what you're saying, which is a good thing. Okay, so let's go ahead and take a look at your head and your face here. First off, again, your skin color looks really good in terms of, I don't see you're not too pale, you're not too dark, you don't look sunburned, you look appropriate for your ethnicity. And let's see, your eyes, ears, nose, they all look symmetrical, terrific. Hair has fine, even distribution. We're going to check your skull here. Skull is normocephalic or normal. All right, so let's go ahead and move on now to a couple of quick tests here. Could you take your glasses off for me? Okay, I'm just going to press here on your sinuses. Any pressure there at all?
No.
Okay, I'm going to press on your T and J. Can you open up for me? Okay, good. No swelling. Excellent. All right, now I'd like you to do each of these things one at a time, and then when I tell you to move on to the next one, stop the previous one and then go. Okay, so for example, if I told you to clench your teeth, okay, and then I told you to squeeze your eyes, you'd stop. There you go, perfect, okay, exactly. So go ahead and clench your teeth for me. Good. Now I want you to squeeze your eyes tightly shut. Good. Now I want you to wrinkle your forehead for me. Okay, can you wrinkle it upwards as well? Okay, good, excellent. And smiling was the next one. You went right into it, great. Can you stick your tongue out for me? Perfect, can you blow out your cheeks? Excellent. So I was just basically testing your cranial nerve 7. We like to test the cranial nerves, make sure there's no malfunctions there. So you did great, fantastic. Now we're gonna move on to your eyes. So if you keep glasses off, so just looking at your eye structure, I don't see any abnormalities. They look equal on both sides, what you call bilaterally. Don't see any type of abnormalities. Your conjunctiva and your sclera are both clear. Your corneas are clear. Your irises are flat and round. Let me go ahead and get a device here just to check your vision. Okay, I want you to look straight ahead. Good. Okay, so pupils are equal to round reacted to light. Let's check accommodation. I just want you to look at my finger. Go straight. Perfect. Excellent. Great job with the eyes. I just want to do a quick check of your, what we call your lacrimal glands there. Any pain, pressure at all?
No.
Okay, and I don't see any discharge or drainage, which is good. So, terrific. So let's go ahead and take a look at your ears. Looking at the ear structures, they both appear to be symmetrical. Skin tone is even, no deformities. A little bit of wax. Canals are pink. Tympanic membrane, which is the membrane that separates your inner and outer ear, pearly gray, and it is. I don't see any fluid buildup behind there. Okay. All right, good. Same thing in this ear. Canals are pink. A little bit of wax in there, but no redness or inflammation. Tympanic membrane's pearly gray. No fluid buildup behind there. So I'd like to check out your nose there if you don't mind. Nose is midline, skin is even tone and consistent with the rest of the face. Let's test the patency there. Sniff. Good. Sniff. Okay. Close your eyes for me. We're going to test cranial nerve 1 here. I'm going to put something there. I want you to tell me if it's sweet, sour, bitter, what you think you smell.
Something sweet.
Okay. What do you smell now?
Very spicy. Pepper.
You got it. Okay, open your eyes, please. All right, terrific. Let's take a look at your mouth. So your lips look good. I don't see any cracks. They could be a little more moist. But no cracks, which is a good thing. Give me a smile. Okay. There we go. Good. Your teeth look wonderful. White, no discoloration, no fractures. Your gums are pink and moist with well-defined margins. Go ahead and open your mouth for me, please. Okay. Looking at the hard palate, that's pink. The soft palate is white. Can you stick out your tongue for me? Good. Tongue is symmetrical, no fissures or cracks. Say ah for me. Good. Uvula rises. That tests cranial nerve 9, and the tongue we were checking was cranial nerve 7. I want you to touch your gag reflex here for me. Okay. Okay, good. Excellent. Wonderful. Now we're going to go ahead and we're going to move on and take a look at your neck. But I did want to mention that your inside oral mucosa was moist as well, which is a good thing. So let's take a look at that. So basically just relax. Neck is supple. Okay, bring your neck down for me. Good. Bring it all the way back. Okay, now bring it forward and to the left. Good. Now bring it to the right. Excellent. So you have full range of motion there. We're going to check your thyroid or your tracheal placement. Good. All right. So when I push like that, your trachea should move in each direction. So that's a good thing. We're going to check for your thyroid. I shouldn't be able to feel it. Okay. And I can't, which is a good thing. Excellent. Now we're going to check your lymph nodes. So we have the pre- and post-auricular, the occipital. We have the jugulodigastic. We have the submental. We have the submandibular. And then we're going to go down here and we're going to check posteriorly. And then we're going to look at your deep and your superficial chains, and those go all the way down. And then we're going to check your supraclavicular. Okay. I didn't feel any swelling. Do you feel any pain or discomfort when I palpated those? Okay. Terrific. And now what I'd like to do is just listen to your carotid arteries and make sure everything sounds good there. Okay, sorry. Okay. Good. So no bruise, no thrills, basically those things we'd be looking for that would tell us that something was wrong.
Okay.
Okay. right, so now we're just going to take a look at your chest here. Has a good contour, has an AP ratio less than 2 to 1. All right, let's see here. I want to test your, take a deep breath in for me. Good. All right, very symmetrical, which is good. You want to be able to have equal breathing on both sides. Let's go ahead and take a listen here. Deep breath. Good. Okay. Deep breath. Deep breath. Good. Excellent. Okay, I'll listen to you in the back. Deep breath. Good. And again. All right. Okay, terrific. So I'm hearing all of the appropriate breath sounds I should be hearing, the bronchial, the bronchiovesicular, and the vesicular, and those will be located here as your bronchiovesicular, and then your vesicular here in the back, in your lower lobes. Your breathing appears to have an even rate. You're not making a lot of effort, which is good, which is normal effort. The depth is appropriate. You're not taking too shallow or too deep of breaths. So good all the way around. What I'd like you to do for me now, though, please, is I'd like you to, actually we can go ahead and we can go and hear everything we need to hear before we have you lay down. I'm going to go ahead and listen to your heart sounds now. Do you have any questions for me so far?
No.
Okay, terrific. Thank you. Appreciate your patience here. Okay, we're going to listen to the aortic here, and that is going to be in the right second interspace. Pulmonic, which is going to be in the left second interspace. Tricuspid, which is going to be in the lower left sternal border. Mitral, which is going to be the left fifth interspace at the midclavicular line. Then we're going to go back and listen to herbs, which is going to be at the third left interspace. Now when I'm listening here, I'm hearing S1 in the apex. That's where it's strongest. I'm hearing it. I'm hearing S2 stronger in the base. Okay, excellent. Can I have you lay down for me? We're just going to do a couple of quick tests here. We want to check for any swelling. We want to check your pulses. Just check your radial pulses first. Good radial pulses, nice, strong, and equal. I'm going to take a look at your legs. Okay, real quick, because what we're looking here for is looking for swelling, what we call edema, and any redness at all. Okay, I don't feel any. We're going to check your posterior tibial pulses. Okay, those are both strong and equal. We're going to check your dorsalis pedis pulses. Okay, those are both strong and equal. Excellent. Okay, now from here we're going to go ahead and look at your abdomen. Do you mind if I lift your shirt? Okay, thank you. I appreciate it. Okay, so we're observing for a contour here. I would basically call this a flat contour, very symmetrical. It does look like we have some striae here. Do you have children?
Yes.
Okay, so we're going to call these from pregnancy as opposed to, you know, losing a lot of weight when you might have been obese. So we're going to have a listen here first. We're going to have a listen here first. Okay, good. Okay, I'm hearing normal active bowel sounds, which is a good thing. Basically, that means that your stomach is working fine in that regard. We're just going to do a little percussion here.
You want to hug a picture of her on my iPad? Come on, we'll go hug a picture of her.
Okay, I'm hearing tympany, which is what we should hear. If we're hearing dullness, that could be some other things we'd have to look into. Okay, we're going to do some light palpation here. Any pressure, discomfort?
No.
Okay. Okay. Now we're going to do a little deeper palpation. We're going to check see if we can feel any of your organs to see if they're unusually enlarged.
Okay.
Because when you normally do deep palpation, you may feel them, but generally you wouldn't. Okay. Is that hurting you at all?
No.
Okay, good. Okay, excellent. Okay, what I'd like you to do for me next is, there was one port that I did miss, so could you sit it for me, because I want to check for what's called costovertebral angle tenderness. So basically I'm just going to give a tap here. Okay, good, no tenderness there at all. Do you mind if I lift your shirt and just take a look at your spine real quick? Okay, excellent. Spine looks aligned, symmetrical. I don't see any deformities or abnormalities. Excellent. Would you squeeze my fingers, please, as hard as you can? Good, all right. Now what I want you to do is I want you to push up against my hands. Good. I want you to push down. Okay, push out. That's fine. Push in. Okay, excellent. Good job. I'd like you to stand up for me, please. And okay, and I'd like you to raise one leg. Whoa, okay, good. Put that leg down, raise the other leg. This is called the Romberg test. You're just testing for balance, basically, okay? And how your body reacts to being unbalanced, because that's something that your brain should normally help you correct. Okay, I'd like you to just go ahead and, oh, bless you. I'd like you just to walk to the end of the hall there and come right back, and I'm just gonna watch you walk and observe what's called your gait. Okay. Well, excellent. Well, that completes our exam. Do you have any questions for me at all?
No, thank you very much.
Thank you for your time. I hope you have a very pleasant day.